Okay. Hi, my name is Jessica and I will be performing a full assessment. This is my lovely patient, and what's your name?
Jessica.
Okay, Jessica, how old are you?
21.
Okay, and do you know where you are right now?
In my house.
Okay, and do you know what day it is today?
It's Sunday.
Sunday. Okay, so as you can see, Jessica is alert and oriented ×3. What's your ethnicity, your genetic background?
Hispanic.
Okay, so her skin color is congruent with her genetic background. And she looks like she is nutritionally okay. She's healthy. She doesn't seem like she's deficient in any sort of nutrition. Her posture is erect, straight. Can you go ahead and stand up and walk around for me? Her range of motion seems like it's okay. She has steady gait. Her mobility is good. Her facial expression is okay for the situation. It's appropriate for the situation. And her mood is okay. She doesn't seem like she's upset about anything. And she talks good. She obviously could listen good because she was able to answer my questions. And her hygiene so far is pretty good. Her hair is clean. Let's check her hands. Her nails are clean. Her shirt is clean. So now I'm going to assess your skin. And your skin is, the color is good for the genetic background, like I said before. She is warm, dry, and she has good texture. I'm going to check your hands. Your cap refill is about 1. There's no signs of clubbing in your nails. Your nails are smooth. And your skin turgor is good, so you are well hydrated. And she seems to be, no lesions are noted anywhere on the skin. And that seems like that's all for the skin. As far as your head and your scalp, I'm going to assess your head. And your hair is clean, like I said earlier. I don't see any lesions. Her scalp is symmetric. Her head is round and congruent for her body size. I don't feel any bumps. I don't see any scratches, no bleeding anywhere. For your face, I'm going to assess her cranial nerve number 7 by asking her to smile and to frown. I'm going to check her mandibular joint. Go ahead and open your mouth, close it, move your jaw side to side. Perfect. Her mandibular joint it's movable, it moves around. Did that hurt at all while you were doing that?
No.
Good. I'm going to check her temporal artery, and it's about a +2. And then I'm going to check her frontal sinuses. Her frontal, does that hurt at all?
No.
And her mandibular. Okay. And I am going to check her eyes next. Let me see your eyes. Okay, and I have my pocket. All right, so I'm going to ask you to look at my pen light, and then go ahead and look at the wall. Good. Her pupils are about a 4, which is good. That's normal. Her eyes are symmetrical. Her eyebrows are symmetrical. Let me just check in here and make sure you have. Good. cranial nerves for her eyes, 3, 4, and 6, and her extraocular muscles. So go ahead and follow my pen. Okay, so she did good with that. I already checked her conjunctiva. Good. Her sclera is white. Her iris is normal. And her retina, let me just check with the pen light. Perfect. So, can't really see me. So her sclera is white and her pupils are perla. They're about 4 centimeters. And now I'm going to check with my light here to check the inside of her eyes. So let me go ahead and see and adjust it. Okay, I'm going to check, okay?
Okay.
Perfect. So her retinal background is pink in color, the vessels are present, and I saw a red reflex. Get this ready for when I do. Okay, now I'm going to check her ears. I'm going to check externally, and her ears look like they are symmetrical. They're both equal in the middle of her head. Do they hurt at all? Does this hurt? No?
No.
Okay. Now I'm going to go ahead and check the inside to check your tympanic membrane. I'm going to go ahead and pull the ear up and back. So far I see that one to be gray and shiny. Perfect. So both of her ears appear to be gray and shiny. She obviously could hear well because she was answering all the questions that I asked her, but I'm going to specifically assess her cranial nerve number 8 by asking her to go open and close her ear as I whisper 3 words in her ear, and she will repeat them back to me.
Blue, red, orange.
Okay, now let's try the other one.
Boy, girl, school.
Good. She was able to repeat the words back to me. Now I'm going to assess her nose. I'm going to check with my pen light the inside of her nose. All right, there's no septal deviation. She seems to be clean. Their mucous membranes are pink in there. Her nose seems to be centered in the middle of her face. I'm going to ask her to go ahead and occlude one nostril and go ahead and breathe through the other one. There you go, and do it to the other one. So there seems to be good patency. Air is flowing in and air is flowing out. Great. I already saw external nose, and good. Good. So her nose is good and clear. Now I'm going to check her mucous membranes for lips. Okay, her lips don't have any cracks, any lesions. Perfect, good. Thank you for smiling. Let me go ahead and check your teeth. Perfect, okay. Her gums are good. There's good with margins. Go ahead and open. Her tongue is pink. There's a lot of saliva in there. And now I'm just going to look at your tonsils. I'm going to use this light. Go ahead and open. push down really quick. And then you're just gonna push back up, mind.
Okay.
This is assessing cranial nerve number 12. Good. And now I'm gonna assess cranial nerve number 9 and 10 by getting a gag reflex.
There it
Terrible. There it is. All right, so let me look again for your tonsils. Tonsils are about a +1 and the uvula is centered perfectly. So as you can see, her gums are tight. They're within the margins. Her teeth are nice and straight. Smile, Jessica. Good. And her mucosa is pink. I'm going to ask you to go ahead and I'll assess your neck. Okay, the back of the neck, the front of the neck. There's the front. Okay, it seems to be symmetrical. Seems to be good. I'm going to check her trachea. It seems to be midline, aligned with the body, symmetrical. Her skin color seems to be congruent with the rest of her body and congruent with the genetic background. There seems to be no lesions, right? None? No abuse anywhere? None. Okay, so now, let's see, so neck, and then I'm gonna use my 8x11 cheat sheet, and I am using it because I can't really say these cervical lymph nodes words correctly. So I'm gonna assess her lymph nodes, and it is the periocular lymph node right in front of the ear. And just let me know if you feel any tenderness or pain as I palpate.
Okay.
The posterior ocular, auricular. All right. The occipital.
Just like a massage.
The submental. The submandibular. The gastric, which is right under here, kind of under the ear. The superior cervical, kind of along the neck muscle. The deep cervical, kind of along the trachea. So we'll do one side at a time. And then the posterior cervical, which is between the neck and the clavicle. And the supraclavicular. Okay. Did you feel any tenderness or pain?
No.
All right, I'm going to check your carotid pulse, one side at a time. And it is bounding at about a 3, up 3+. I'm going to listen to see if I hear any bruits present. And no bruits were present, which is a good thing. We don't want bruits to be present. All right. I already checked the here. Okay, good. All right, so let's see. I'm going to assess cranial nerve 11. So I'm going to ask you to please go ahead and shrug your shoulders. Good. And then put your head side to side, push side to side. All right, can you move your head up and back? All right. Go ahead and move your face side to side. Good. Now I'm going to assess your thyroid. I just assessed her cranial nerve number 11 and it was intact. All right, I'm going to check her thyroid. Okay, take a big gulp for me. Do it again. Good. Her thyroid was non-palpable. It seemed to be, does it hurt when I touch it?
No.
Didn't hurt either. I didn't hear her say ow or anything. Now I'm gonna check her back of her lungs first, and then I'll go ahead and make my way to the front. Okay. All right, let me look first. Her back seems to be in congruency with her genetic background, the color of her skin. It is warm and dry to touch, and the texture is normal. The skin is smooth, and her spine is at midline. Go ahead and take a deep breath for me. Okay, good. The thoracic shape is good as well. I'm going to go ahead and listen to your lungs. Take a deep breath for me. Good. Her lungs expand normally. Her thoracic cage ratio is at a 2:1. And her, let's see, I don't see any bruises or lesions on her back either. I'm gonna go ahead and lower her shirt because it's kind of cold. So I'm gonna check for her tactile formalities, and I'm just, every time I put my hand, the palm of my hand on your back, you're gonna go ahead and say 99.
Okay. 99, 99, 99, 99, 99, 99, 99, 99, 99.
Vibrations were felt equal bilaterally. Now I'm going to go ahead and percuss. So far, resonant is in all lung fields. It is clear and low-pitched. As I listened to her lungs were clear bilaterally. There was no signs of adventitious breath sounds. Now I have to check her CVA, for CVA tenderness. Jessica, go ahead and let me know if you feel any tenderness when I do this, okay?
Okay.
Did you feel anything?
No.
No. Okay, good. Now I'm going, so that there's no CVA tenderness. Now I'm going to measure for the diaphragmatic exertion. So I'm going to ask you to take a breathe out and hold. Okay, and go ahead and breathe in and hold. Now I measure from the top to the bottom. It's about 4 centimeters. Okay. So far that is done. I'm done with the back side of her lungs. Now we're going to go ahead and move to the front part of her lungs. And I'm just going to look really quick and see if there's any abnormalities with her skin color. Her skin color seems congruent with her genetic background. There seems to be no lesions. Her skin is warm, dry, and smooth in texture. I'm going to go ahead and listen to her breath sounds before I palpate or percuss. Go ahead and take a deep breath. Good. Now I'm going to check for the tactile formalities again. I'm going to put the palm of my hand on your chest, and you're going to go ahead and say 99.
99, 99, 99, 99, 99, 99, 99.
Okay, good. So it was resonant, and she was okay. She had normal vibrations in her lung, the front of her chest. Now I am going to percuss. And does anything hurt?
No.
Okay. Go ahead and lean forward for me, and I'm just going to check one more time in your back. Okay. So everything in her lungs feel normal. The percussion and the resonance all throughout her lung fields were normal. Let's see what else. Okay, so I need you to please stand up for me. I'm going to assess her range of motion. Okay, sorry. I can't move the table. Okay, I'm going to assess her range of motion. So if you could please put your hands forward like this. Okay, and behind your back. We'll put them behind your head. Okay. All right, and put them out in front of you. Go ahead and move your fingers like this. All right, go ahead and move forward for me. Good. Move back. All right. Now put resistance towards my hands. All right, and now upward. Perfect. Now if you can go ahead and rotate your ankle and the other ankle. Good. Now move forward a little bit so you don't hit the back of your foot. Go ahead and flex your knee and the other one. Perfect. Arms behind your back. Okay. And now I'm going to palpate your antecubital nodes. Good. So the patient appears to have full range of motion. She's able to move her upper and lower extremities pretty well. I'm going to ask her to just see if she can walk on her heels. Okay, go ahead and walk on your toes. Good. All right, if you could sit down for me and lay back. Okay, let me get my measuring stuff. Okay. Now I'm going to assess her jugular vein. And that is one strong. Okay, now I'm going to palpate to feel for any tenderness of her liver, kidneys, and spleen. Let me know if you feel any pain. Nope. No pain? Okay, the other side. Alright. Now I'm going to assess the diameter of the liver. Let's see. Centimeters, not inches. Okay. And that's about 8 centimeters. So if you could go ahead and sit up for me. Good. Okay, so her spleen, liver, and kidneys were non-palpable, they were non-tender. She didn't feel any pain as I was assessing those for her. Now I'm going to check her heart out. And I'm going to just look to be sure that everything's okay. Let me just... I don't really want to... Okay. All right, if you could go ahead and lay back for me. So I just looked and I assessed her pericardium and the pulse. The pulse is not seen. There was no pulse seen or felt. I'm trying to feel for it now. And there's no heave. I'm going to assess all 4 heart sounds, starting with the apical. Okay. The heart is strong. There's S1 and S2 sounds present with no extra heart sounds, and the rhythm appears to be regular. Now I will assess her apical pulse for 1 full minute. And the minute starts now. is about 68 beats a minute. All right, go ahead and stand up for me. Okay, good. Okay. All right. I guess I did the lungs, the heart, the stomach. Okay, let's lay back, and I'm going to assess your abdomen. First, I'm going to look and see. So her skin color is congruent to her genetic background. Her skin appears to be warm, soft, smooth in texture, with no lesions. Seems to be okay. Let's see. I'm gonna go ahead and listen for any vowel sounds. Her vowel sounds are active. Now, let me warm up my hands a little bit. And now I'm going to go ahead and palpate her abdomen. Well, percuss her abdomen first, clockwise. Seems to be okay. Her stomach is round. Now I'm going to do a soft palpation. You just let me know if it hurts, okay?
Okay.
No muscle rigidity is noted. Did you feel any pain?
No.
Now I will feel a deep palpation. No masses, no bumps, no abnormalities are found. Go ahead and sit up for me. Okay. I assessed for the vowel sounds. She was okay. Her vowel sounds were good. I didn't find any masses or any abnormalities in her stomach. Now we're going to assess the her senses, her neural senses. I'm going to go ahead and have you close your eyes, and I'm going to assess. I'm going to touch your face with a cotton ball, and you're going to tell me when you feel it, okay?
No. 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 Tickle. No.
Sorry.
No. No.
Okay, good. All right, and I'm going to go ahead and close your eyes and open your hand. And I'm going to put this in her hand, and you're going to tell me what it is, okay?
A paperclip.
Good. All right, open your eyes. Now I'm going to check your lower extremities. Okay, so hold on. Let me just check your pulses of your feet. I'm going to check 3 pulses that the foot has. The palpatile, which appears to be normal, +2. The posterior tibial, which appears to be normal on both feet. And the dorsal, which also appears to be normal on both feet. I'm going to check her cap refill on her feet, less than 1 on both. Hair is evenly distributed on both legs. Her skin appears to be congruent with her genetic background. They are smooth, warm, and dry. And no edema is noted. No bunions are seen. Thank God. And now now I'm just going to ask you to use your hands and go ahead and open your fingers, close your fingers. Go ahead and touch every single finger like this. Good. Move your ankle and foot like this. Oh yeah, like that. All right, and please stand up for me and walking, touching your toes. All right, perfect. Again, she has full range of motions of her lower extremities. And now I'm going to assess for, okay, we already assessed that she could tell that this was a paper clip. All right, now I'm going to see, tell me whether it's sharp or dull, okay?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Good. Okay, tell me whether I'm putting your finger up or down.
Down. Up. Down. Up. Up. Down. Up. Down.
Perfect. Good. So far her neuro seems to be good and intact. Go ahead and stand up for me and close your eyes. And go ahead and put your heel to your knee and move it down to your ankle. Good. And do the same with the other foot. Good. Go ahead and sit down for me. We just checked and tested her cerebellar reflex. We're going to check for her Babinski. Good. And nothing was seen, so that's good for people that are adults. Go ahead and touch your nose with your hand. Good. And the other hand. Okay, good. Now we are going to check your reflexes. All right, go ahead and, do it like this. Okay, good. All right, and we're going to push the thumb back. And now we're going to assess the legs. Good. So her reflexes are good. Her Babinski came out to be negative. Let's see what else I could do to you. We're going to get up really quick. We're going to assess your musculoskeletal again. I know I've been doing it kind of in pieces. Go ahead and touch your toes. We're going to assess your spine more now. Okay, go ahead and stand up for me. If you could rotate side to side. Bend forward-ish. Move back. Okay, if you could just go ahead and walk forward. And then walk backwards. And then the Romberg sign. We're going to do the Romberg sign. We're going to ask you to close your eyes. And just lift up your hands like that. No swaying is noted, no abnormalities. All right, you could open. And that's it. We completed this physical assessment. Thank you for watching.
Do I just press the record button?